Complications of diabetes. Just like in any other illnesses, the first thing that people need is to be informed and educated about the disease that may be prone to. In case of diabetes, extensive knowledge about this can help people who are already suffering from it to cope up and manage, and can also help those who don't have it yet to be more careful and to avoid the illness. But, aside from having extensive knowledge on the disease such as its causes, symptoms, diagnosis and treatment, it also pays to know if there would be related complications. This is to prepare oneself emotionally, physically, and emotionally about the possibilities of coping not just with diabetes but other complications related to it as well. There are certain factors that affect people to be prone to diabetes, such as age, heredity and ethnicity. But regardless of the risk factors, the related complications would just be the same. The following are just some of the complications of diabetes that people who are prone to it must pay attention to. 1. Heart disease and stroke. Experts say that people who have diabetes have greater risks to having coronary heart diseases and to stroke compared to those who don't have them. In fact, these complications are the lead causes of death among diabetics all over the world. People suffering from diabetes are prone to heart diseases and stroke because the fatty deposits brought by drastic changes in the body can block the arteries and leads to heart attack. Because of lesser amount of insulin in the body compared to regular people, diabetics have higher incidence of blood clotting and can also lead to high blood pressure or hypertension. 2. Diabetic kidney disease. Among people with diabetes, kidney failure is the most common complication because the blood filtering units of the kidneys are being damaged. Once the kidney has been damaged, important proteins are being along with urine, and eventually, the kidneys won't be able to remove the waste products present in the blood anymore. The good thing is, not all diabetics experience end-stage kidney disease, ESRD, which can be life-threatening. To avoid this complication, you must stop smoking cigarettes and always keep the blood pressure under control at all times. 3. Diabetic eye disease. This refers to the group of eye problems that people with diabetes may have as a result of the chronic disease. In worst cases, this set of eye-related problems such as diabetic retinopathy, damaged vessels of the eye's retina, cataract, cloudiness in the lens of the eyes, glaucoma, and increased fluid pressure inside the eye that is damaging to optic nerve. All of these, when not treated immediately and now monitored properly, can lead to total loss of vision loss or blindness. 4. Diabetic neuropathy. Those people who are into smoking, drinking, and those who have poor control with glucose are more prone to developing neuropathy compared to those diabetics who are not into these vices and bad habits. 5. Gastroparesis. This disorder involves the stomach as a result of prolonged emptying. Studies show that around 20 to 30% of diabetics suffering from type 1 diabetes are more prone to this diabetes complication because it severely damages the vagus nerve, which is responsible for keeping the food moving through the digestive tract. Although it is also diagnosed among those who have type 2 diabetes, the cases are comparatively lower. Well, we hope this information is useful to you. If you've made it this far, you can go to the first link in the description to claim a report that we have prepared to help you with your health. But first, don't forget to subscribe and share this video. Have a nice day.